Corona. I am a research assistant at the Central Valley Health Policy Institute. I am joined today by my coworker Miguel Garcia.
Hello, everyone. My name is Miguel Garcia, and I'm also a research assistant at Central Valley Health Policy Institute.
Thank you, Miguel. We will be presenting a case study that focuses on power building around the work accomplished through the COVID-19 Equity Project during the pandemic. With that said, let's begin by talking about the purpose of this case study. This case study aims to do two things. First and foremost, it aims to highlight three health equity leaders, including Sandra Celedon, Genoveva Islas, and Dr. Tanya Pacheco Warner. These three leaders have been involved with the Fresno Building Healthy Communities Coalition, or also known as Fresno BHC Coalition, and they helped develop the Immigrant and Refugee Coalition's COVID-19 Equity Project, or CEP. CEP was designed to address critical COVID-19 related health disparities that disproportionately affected underserved communities and hard-to-reach populations here in Fresno County. Second, this case study also aims to highlight the efforts of their coalition and their leadership in navigating the socio-political barriers to establishing and sustaining the community health worker model, powered by community-based organizations and local institutions. This also includes the Central Valley Health Policy Institute at Fresno State, who all share more than a decade of history advancing health equity for vulnerable populations. Having said that, we would like to start by talking about the health equity leaders that contributed to the development of CEP. Beginning with Sandra Celedon. As the president and CEO of Fresno BHC, Celedon has been a driving force in making the community healthier and safer for its residents. Celedon's inspiration comes from a close-to-home place, Kawa, a small rural community in South Fresno that embraced her and helped her grow. Celedon moved there from Mexico as a child and found a supportive environment that nurtured her from childhood to adulthood. Before her role at Fresno BHC, Celedon was making waves at Clínica Sierra Vista, where she managed outreach and enrollment programs. This health center was committed to giving underserved communities the healthcare resources and healthcare access they needed. Celedon is no stranger to recognition either. She has received multiple awards from her dedication over the years. In 2020, she was recognized as a Health and Human Services hero for making a difference in the Central Valley by Fresno State's College of Health and Human Services in that same year. She took on a big role as vice chair for the Fresno Commission on Policy Reform. This commission is all about coming up with community-based ideas to improve the Fresno Police Department. Additionally, in 2021, she received the Companions for Equity Award for being a racial justice leader. She has also held important positions like being on the board of directors for the Public Policy Institute of California and Catalyst California. Lastly, Celedon has presented on the CEP work at both state and federal levels. Most recently, she shared the CEP outcomes at the White House and the Centers for Disease Control and Prevention Summit on COVID-19 Equity and what work showcase. The COVID-19 Equity Project model was recognized as a best practice to lead.
Next, but equally important, we have Genoveva Islas. Islas is the founder of Cultiva la Salud. She's dedicated to improving health services for families who are often overlooked. Islas comes from a background of farm laborers and grew up in a small rural area in Fresno, California. Despite her humble beginnings, she became the first in her family to go to college and earn an advanced degree. Her work focuses on helping families lead healthier lives by increasing their access to nutritious foods, drinks, and exercise. From 2006 to 2012, she led the Central California Regional Obesity Prevention Program, connecting public health departments and community-based organizations in the San Joaquin Valley to provide resources for healthier living. She has held various positions, including serving on the Health Benefit Exchange Board for California and the California Partnership of the San Joaquin Valley Board. She currently serves on the Fresno Unified School District School Board. Islas has made a big impact recently. Her organization Cultiva la Salud launched a program called Saving the Señoras, which helps elderly women access groceries, household items, and hygiene products, especially important during the pandemic. In 2023, she received the St. Agnes Community Award for making COVID-19 vaccines available to Latino communities in rural Fresno County. She was also honored as Woman of the Year by Dr. Joaquin Arambula for California Assembly District 31, recognizing her positive contributions to her community. Additionally, she was recognized as a Health and Human Service Hero and has been recognized as a Culture of Health Leader by the Robert Wood Johnson Foundation. Last but not least, we have Dr. Tania Pacheco Werner, who is the director of the Central Valley Health Policy Institute at Fresno State. Pacheco Werner was born in Mexico and came to the United States when she was young. Growing up in a country and learning a second language were tough experiences. Some people made hurtful comments suggesting she didn't belong and couldn't contribute to society. Despite these challenges, Pacheco Werner worked hard to make a difference. While she was studying at the University of California, San Francisco, she joined CBHPI as a health policy intern. Throughout her journey, she focused on studying problems that affect community health, such as air pollution and how it harms people's health, especially those who are more vulnerable. In 2021, she joined a discussion panel called Exposing Inequities and Expanding Access, Building a Better Healthcare System for the Latino Community, which was part of the California Latino Legislative Caucus 2021 Policy Conference. During the same year, she was also a guest on the SAGE podcast, where she talked about the importance of getting vaccinated, explained the differences between the available vaccines, and addressed various questions and concerns. Additionally, in 2022, Dr. Pacheco Werner was asked to be a panelist in the Funding the Next Generation event, where the discussion focused on exploring the role of the CARES Act funding in reshaping public health practices beyond traditional government boundaries. During the same year, she was elected as Woman of the Year by Dr. Joaquin Arambula for California Assembly District 31, and she was also named Educator of the Year in the college category by the Mexican American Education Association for the weekly resources called and education videos that she had and other members of the CBHPI team conducted during the pandemic. Now, let's turn our attention to the COVID Equity Project and TC's theory of change. The Fresno BHC Coalition was formed as part of the California Endowment's Building Healthy Communities initiative. The goal was to improve health fairness by investing in building capabilities, changing policies and systems, and altering the environment over the long term. They provided support to strengthen coalition partners and conducted training with experts to understand how systems and policies function. However, midway through the project, the approach was adjusted to prioritize local community involvement and empowerment, acknowledging the importance of giving historically excluded residents a say in decisions to promote inclusivity and address health disparities. Even though the statewide Building Healthy Communities (BHC) initiative ended in 2020, its plans and goals are still important for promoting fair health practices in Fresno, including the CEP. The CEP follows the BHC's approach, especially its focus on changing systems and practices. It uses the public health system to provide pandemic-related testing, treatment, and social services to communities that were often left out. The CEP also sticks to the BHC's idea of meeting people where they are. This means the program goes directly to underserved communities in the county to offer pandemic-related information, testing, treatment, and financial and social support regardless of health coverage or documentation status.
One of the reasons why they were able to meet people where they were where they are was because the CEP utilized a community health worker model, or also known as CHW model, or a promotora model. The CHW model had initially been piloted in 2008 when CBHPI had secured funding to investigate and develop it as a way to improve ongoing inequities in access to healthcare faced by Latinos. A study using the model proved beneficial for undocumented Latinos prior to the implementation of the Patient Protection and Affordable Care Act. Therefore, Dr. Pacheco Warner knew the model was a potential fit for other vulnerable communities. Thus, when the pandemic-related lockdowns began, Dr. Pacheco Warner wanted to implement a replication of this model to improve healthcare access for immigrants, refugees, and undocumented residents who are the most likely to face obstacles to accessing healthcare and coverage, and also to provide support services for underserved communities and hard-to-reach populations. Through this model, local community members who come from similar backgrounds and cultures as the communities they were trying to serve were trained as CHWs. At the organizational level, integrating the CEP structure into existing city and county government agencies was challenging at the decision-making level. While IRC was able to secure $12 million in funding for the implementation of the CEP model, it was difficult to retain control of how the program operated and who would lead the work while working with county governing bodies. Additionally, even though the Immigrant and Refugee Coalition has spent the last decade working together on addressing social determinants of health, it was noted during interviews that their professional experience was downplayed by the Board of Supervisors. In one interview, it was put forward that this could be because IRC is mostly composed of individuals who identify as women, people of color, and immigrants. Despite these challenges, the IRC and its leaders were able to secure the $12 million to lead the CEP, which represents all the power that they have built over the years to bring resources and expertise to Fresno County. And it goes to show that they were more than prepared to lead. At the beginning, Fresno BHC was not chosen as a fiscal agent for this work. However, Fresno BHC took over this role as the program continued, supported by years of experience and expertise in such a role. As you can imagine, these leadership roles are important. These positions allow organizations the power to provide funds and make decisions that improve health equity for vulnerable populations. Unfortunately, the Fresno County Board of Supervisors removed Fresno BHC from the role as the CEP evolved as an ongoing project post-pandemic. It goes without saying that CBO leaders who crafted the pandemic response model and who wanted to see Fresno BHC remain in this oversight role were disappointed about the decision to remove Fresno BHC as a fiscal agent. Celedon, Fresno BHC's CEO, still viewed the CEP as a significant win, as it embedded a novel health equity model into a mainstream source of healthcare in the county. Celedon shared with us, ultimately, the desire is there to embed the CHW model. Even if you are giving our model to somebody else, it tells me you want to implement a model that prioritizes health equity and battles, and that's half the battle. Also, in our conversations with Dr. Pacheco Warner, she mentioned that some of the initial difficulty in getting an agreement from local government bodies had to do with how the COVID-19 Equity Project challenged old systems used to address community health. These old systems, she said, produce and reproduce inequities in community health outcomes. In addition to that, it's crucial to mention that IRC's CEP leaders knew that if they wanted to avoid reproducing inequities that already exist in community health outcomes, they had to challenge the system, especially because COVID-19 exacerbated existing inequities health inequities across the board, and that the least they could do was to be intentional about the approach they could use so that they could not add to these inequities. For example, IRC leaders understood that it was essential to address barriers due to race, ethnicity, language, and immigration status head on to avoid reproducing inequities. So they made sure that the CHW aspect of the CEP utilized a workforce of resident leaders, many of whom are women of color and immigrants, who received extensive training and expertise but would otherwise be overlooked as candidates in traditional health programs. In all honesty, it was a challenge getting resident leaders, women of color, and immigrants to have these roles despite their extensive training and expertise, because it's simply not the norm in terms of how the county has operated historically.
Although there have been important movements in Fresno County, there hadn't been an actual redesigning of a pandemic or an emergency health response, and that itself is a challenge. The COVID-19 Equity Project is a novel approach and is disruptive to the way things have been historically done. It redesigned the role of the community by allowing them to become experts instead of being a problem to be solved. In other words, it invested in community and in building community experts, and it focused on getting the community together to be part of the solution. It showed that the community isn't the problem, but that COVID-19 is. As we saw through the presentation, the CEP showed that it is important to shift the way we think, talk about, and implement pandemic or emergency public health responses if we want to avoid reproducing inequities in community health outcomes, even if this means challenging the system, just like the IRC leaders did with CEP and its novel approach that centers community as the solution. That lifts up experts who can play a critical role in the community, and that provides resources to underserved communities and hard-to-reach populations in Fresno County. As you can imagine, the CEP is a notable success. It was actually highlighted by the CDC in their What Works White House showcase. The model has also been praised by the governor's office as a place-based solution to addressing pandemic-related health challenges. Additionally, it has been replicated in Monterey and Santa Cruz counties, challenging the long-standing idea that CBOs and CHWs are not a good fit for sustaining a community health model. Additionally, the CEP distributed thousands of COVID-19 tests and vaccinations in Fresno County. It also provided the community with a vital COVID-19 related educational information in multiple languages and deployed more than 100 CHWs throughout the county. In fact, 40 of these CHWs were embedded into the Fresno Unified School District. Overall, the CEP leveraged more than $12 million in funds to address COVID-19 health equity efforts, and according to Dr. Pacheco's, CEP has become a launchpad for CBOs to expand their health equity work through new funders, including larger philanthropy groups. To wrap things up, I'd like to highlight that the power building work that laid the foundation for the IRC and CEP has led to new programs and projects that center health equity and to utilize the CHW model in new ways. It has been successful in opening the doors for innovation in how community public health is shaped in Fresno County. This concludes our presentation. Thank you so much for joining us today. At this point, we will transition into the Q&A session. If you have any questions, please put them in the chat, raise your hand using the raise your hand feature, and we will start with the ones that are already there.